Parents, listen up. New medical guidelines from the American Academy of Pediatrics say your child could be prescribed weight loss medication or recommended for weight loss surgery as young as middle school age. As you can imagine, the recommendations have prompted mixed reactions. Zach Merchant breaks down what you need to know.
More than 14 million American children are obese, according to the American Academy of Pediatrics. Now, that medical group is proposing new treatment guidelines to combat that. For some patients as young as 12 years old, they say doctors should consider prescribing weight loss medications. And some kids as young as 13 should be evaluated for weight loss surgery.
And this is the most striking point.
According to Dr. Jenny Gorgery, an associate professor at Georgetown and a pediatric endocrinologist, the new advice reflects concerns that childhood obesity, if left unchecked, can lead to major health problems early in life.
The process for high blood pressure and heart attacks and strokes when you're 30 and 40 starts when you are 15.
But doctors are only advised to consider these tools when other, less invasive approaches have not worked.
Prescription medications and surgery, those are treatments for people who have persistent, ongoing, severe obesity.
Absolutely, yes. Absolutely. And we're not talking about, just a few pounds. This is really, really severe obesity that you would consider these medications for.
The first-line treatment remains the same, making sure children are active and eating healthy, something YMCA of Metropolitan Washington programs provide to thousands of kids each year.
Prevention and lifestyle still is key. Where it gets tricky is whether or not a child or a family has access to safe spaces to be physically active, or if they have access to healthy foods.
And Dr. Gorgery stresses that, as with other medical treatments, the parent and patient are the ultimate decision makers.
My role as a physician is to help people, give them the information they need, help them decide for themselves when they have the full picture.
Again, there are long-term risks associated with children being obese at a young age. Dr. Soren Johnson is a pediatrician with Novant Health. He says childhood obesity puts kids at risk for health problems like sleep apnea, liver problems, diabetes, and more.
Long-term, we know that the longer that you have problems with obesity, or the longer that you have diabetes, the more and more likely you are to have cardiovascular disease, so problems with the heart down the road.
Like many other conditions, COVID-19 has made childhood obesity worse. Dr. Johnson says more than a year of remote learning has given children more reason to be sedentary. So what can you do as a parent? Dr. Johnson says there are several ways to get kids active.
Number one thing is probably cutting down on screen usage, and some of the times, we say that we have to look in the mirror and be like, what example am I giving to my child? Am I staring at my phone all day? Sometimes that's the place to start. Be like, maybe I should change my habits, and that'll help my kid be more active.
In addition to promoting physical fitness like sports, jump rope, and bike riding, Dr. Johnson says families should try to eliminate sweet beverages like sodas, flavored milk, and sports energy drinks.
Basically, an extra 3,000 calories is going to equate to about a pound of fat in the body. And if you're drinking a soda a day, that's an extra 180 calories. You can do the math. Over 2 weeks, you're gaining an extra 3,000 calories. So that's 2 weeks per, a pound every 2 weeks of extra sugar your body didn't need.
For the toddlers who may not be old enough for organized sports and activities, Dr. Johnson suggests taking them to the park or just getting outside where he says they're naturally going to move. Another place healthy habits can start is in the school lunch line. Ben Thompson connects the dots on research about the impact of the last major push for healthier school lunches.
Can healthier school lunches really reduce obesity? Let's connect the dots. Childhood obesity has been rising for decades, and now it affects about 1 in 5 U.S. kids. Back in 2010, a federal law championed by then First Lady Michelle Obama increased the quantity of fruits, vegetables, and whole grains required in school meals. That change impacting millions of kids across the country. A national study found a small but significant decline in the average body mass index of more than 14,000 school kids. Their heights and weights were tracked before and after the Healthy Hunger Free Kids Act of 2010 was implemented. Experts note this flattening is important as holding kids' weight steady as they grow can help keep their obesity in check. Doctors add that more changes could have the potential to impact excessive weight gain over the course of an entire childhood. And that is Connecting the Dots.
Remember, even small changes can help get your children in a healthier place.